I just came back from Dallas, from the Dallas Rhinoplasty Dallas Cosmetic meeting in March of 2024. I wanted to talk about some of the takeaways and also at the end figure out why you should actually come to the meeting. So of course this is geared towards people who inject or who are really surgeons, including surgeons in training and surgeons out there in practice. I think it's a great meeting. Overall, it's 4 days. We have a lot of lectures. We also have cadaver lab, so you can apply your new knowledge and learn or relearn anatomy and apply it to your own practice and to your patients. In terms of the non-invasive stuff, I think the biggest takeaway for me was a more holistic approach. The holistic approach is where we're taking care of the patient in terms of everything. We're no longer just thinking about, golly, you need some Botox or you need some filler. We're talking about taking your whole face, giving you the best in terms of skin resurfacing or skincare medication, as well as a procedure, as well as neurotoxin, modulator, fillers, other things like that, as well as the aftercare. So I think this is a big trend in dermatology and overall health, so I think this trend will continue. In terms of breast, I've touched about this in the past, but Motiva breast implants are very hot in the United States. I can't wait until they're FDA approved finally and come out. And the reason why is that it's a very cool technology where they're technically smooth shell, but they should have less tissue reaction than other types of implants that we currently have. So this will require an even more precise breast implant pocket dissection, but I do think that patients will like it more. In terms of liposuction and body contouring, the biggest one was Dr. Alfredo Hoyos. He came out with a new textbook that was literally just released during the conference, Rib Revolution. So there is a way to actually green stick fracture. It's sort of a slightly more gentle way to actually fracture the ribs, where it doesn't hurt that much, but you can have a very thin waist or just a thinner waist, depending on the patient preference as well as the surgeon preference, coupled with 3D liposculpture, whether it's high definition or even just moderate or low definition liposuction. We can actually carve out the abs, especially in female patients, and really get a thin waist. So I think this is, again, almost a revolutionary step, an update on body contouring, and it's a great textbook. I purchased a copy and I'm looking forward to doing more and more cases and seeing more in patients sort of out there in reality. In terms of the face, I do think, again, it's a much more holistic approach. Dr. Cheryl Aston gave a great background talk on the history of the deep plane facelift. It's been around really for decades, and it's come back in terms of popularity as a marketing term. But as a plastic surgeon, I think that we are not doing a great job of explaining, hey, what does deep face, deep plane, face plane, what's all this stuff mean? I think deep plane sounds really cool to customers, to patients, to consumers, because they think that's better. Well, it's been around for a long time and it's not necessarily better because it really depends on the patient. So definitely, I'm gonna come up with an upcoming video on that, but essentially I do think it does well, but not quite in everybody. Finally, with rhinoplasty, I do think that the biggest change is a huge emphasis on what we call preservation rhinoplasty. So classically, what we used to do in rhinoplasty, and this is like more like 30, 40, 50 years ago, was a closed rhinoplasty. No incision across the columella. In other words, no incision across here between the right and left nostrils. However, we were able to deliver the cartilage into the surgical plane without making that incision. So the problem was, sometimes it's not really bilaterally symmetric. It's a more difficult procedure. We didn't have as much knowledge about the cartilage as we do today. So it increasingly became out of favor. We came up with an open rhinoplasty approach, also known as structural rhinoplasty, where we're actually able to see both sides. Now, it is a small, tiny incision across the columella, the area of skin between the right and left nostril. So we're able to camouflage it better, and honestly, it's a great approach, and it's been doing great and very well. It's the most popular way to do it for, I'd say the past 20 to 30 years. Over the past, say 5 years, there's been a large increase in what we call preservation rhinoplasty, where we're trying to do a little less dissection. We're more aware of the anatomic ligaments that really hold the nose together, and we try to avoid those ligaments if possible with surgery. So if you have less dissection, you should have less swelling and less bruising and less overall pain. And that's true for the most cases. However, I think that with our increasing knowledge of subtle nasal anatomy, it's a little overblown in the sense that we can't give everybody true preservation rhinoplasty techniques. So this conference was great because we're starting to realize some of the great things and some of the limitations. It really depends on the patient. It depends on your nose. It depends on what you want. As always, the anatomy is always the same, but every patient is different. So it truly depends on whether that approach is best for you or not. And we had, golly, a ton of lectures about it, as well as cadaver lab. So that was a lot of fun. So why go to this conference? And of course, if you're a patient, you can't really go. But I'm talking to all the future plastic surgeons out there, the plastic surgeons in training, or even if you've been out for a long time. The biggest thing is the ability to interact and talk to world experts. So there is no other conference that I'm aware of with this many world experts in a smaller setting. You can always ask questions at any plastic surgery conference, I think. The problem is that typically it is very difficult to ask a question. The Q&A sessions may run out of time. It's hard to ask some questions in front of 2,000 or 3,000 people. So since this conference is smaller, it is definitely easier to get your question actually asked, and the speakers will definitely answer it. Also, in cadaver lab, you can actually not apply your new knowledge of anatomy, but you can ask the world expert who invented the technique how to do it, if they can show you some subtleties. And that's very rare. I don't know really of any other conference that has world experts leading you in the dissection to actually be able to do that. So I think that's a fantastic option with this conference. And so, yeah, the cadaver lab's optional, but I would just tell you just to sign up for it automatically. I think you're gonna learn a lot. The other thing is that you'll actually see stuff that doesn't exist on the internet. And by that I mean patient photographs as well as video. So you think everything's on the internet, the actual answer is absolutely not. Some of the photos of patients are where the patients have consented to be shown at an educational conference, but nowhere else. And even then, their features are blurred, so you can't tell who these people are at all. So why is that so important? Because to see some of the intraoperative photos and videos of how to do a procedure, they don't exist in textbooks. They're definitely not on the internet because the patients haven't given consent. And for the patients out there who are worried, I mean, I can't tell who you are because a lot of this stuff is like in the operation. Now, of course, it's gross to a consumer, but to a patient, it's like, well, I can't identify anything. And to a surgeon, it's like, wow, this is really cool. It's like I'm over the shoulder of the actual plastic surgeon that's doing the procedure. I can see what they're thinking, I can see what they're doing, and I can see this maneuver to deliver a better aesthetic result and give it to my own patients. That sort of stuff doesn't exist in any other conference I've been aware of, and certainly not to this level of anatomic knowledge. The sort of hints and all of those aspects where that photo, that video is nowhere else except at the Dallas Rhinoplasty, Dallas Cosmetic Clinic and the meeting. The final reason why you should go is that you will get the unvarnished truth, or at least a really strong opinion about certain things. So we do have panels from these speakers on the best way to do a certain case. The pearls, the tweaks, the hacks, the hints from world experts on rhinoplasty or facelift, even social media. And that unvarnished truth or very strong opinion, a lot of times it's not recorded at this meeting at all. So I learned a lot on how to treat patients better, how to actually have patients ask me questions. I find that I'm lacking with some video answers, so I'm going to be making even more videos to torture the world and also to get the message out there, because I strongly believe in patient education. We need to have less miscommunication, but also the world experts just gave a lot of great information on how to deal with the complication, how to deal with this patient, how to deal with this problem. And that stuff, again, it doesn't exist in textbooks that I'm aware of. It does not exist in any other conference that I'm aware of. And it actually was not recorded. So even if you purchased, I don't know, the online version of our conference, Dallas Rhinoplasty, Dallas Cosmetic, it doesn't exist. So you have to be there in person to interact and to see some of the photos and videos, as well as get the real answers, the real opinions. The other thing that goes along with that, of course, is that since it's a smaller conference, there's a lot of networking. So we have a reception every day. There is a lot of interactivity in between the lectures. You can ask the speakers exactly what the answer is for a certain problem you may have. The actual speakers, sometimes they bring in tough cases and they ask the audience, so what would you do? And sometimes they're actually asking what to do because it's a difficult case. Again, that stuff you're only gonna see live at the conference. So I hope you can tell that I'm sort of excited about being part of Dallas Rhinoplasty, Dallas Cosmetic. Yes, I'm the social media director, but I am the social media director for a reason. I really believe in the educational aspect. Patient safety is always first. And so we're learning that and we're applying our knowledge to get better and better outcomes. So If you have any questions, you have concerns about the content, or you just simply want to have a different topic that you want me to talk about, please let me know. Take care and have a great day.